And for that, we have on stage Dr. Monika Gupta, General Manager Technical from FICCI Research and Analysis Center. And I'm looking forward to a great session from Dr. Gupta. Monika ji, the stage is all yours, and I'm looking forward to a great session from your side. Can we have a big round of applause for Dr. Gupta?
First of all, good morning, everyone. Myself, Dr. Monika Gupta, and I'm associated with FICCI Research and Analysis Center. And basically, I did my PhD in pesticide residues from CSIR Institute, IHBT, Palampur. And I'm in this field from last 18 years in testing. And I'm also associated with NABL as a lead assessor as well as technical assessor in chemical discipline. And so today I would be discussing about the fortification and challenges. We had lots of discussion in the panels also. Still, I would go through it. So in basic, what is nutrition? In a layman language, nutrition is about eating a healthy and balanced diet. And in chemical terms, we can say nutrition is biochemical and physiological process by which an organism uses the food to support its life. When we talk about the nutrients, there are mainly the 7 classes, we say macronutrients and micronutrients. Like carbohydrates, protein, fats, fibers, these are the macronutrients, vitamins, minerals, we say these are the micronutrients. And what are the sources? Then majorly the sources are which are rich in nutrients are fruits and vegetables. Along with that, meat, fish, whole grain, dairy, legume, nuts, seeds are also high in nutrients. So what happens, even if I will say about myself, sometimes I am complaining that I am eating a diet, means I am taking a food three meals or 4 meals a day. Still, when I am going for checking, for testing, then I came to know I am anemic. So maybe I am not having a balanced diet. So due to the deficiency of these micronutrients, these results in deficiencies and further linked to further diseases. So now what is the need for fortification? Actually, what is fortification? We have already discussed is the addition of micronutrients, that is vitamins or minerals such as iron, iodine, zinc, vitamin A and D to the staple food. Why these staple foods have been selected as a vehicles? Maybe because these are the foods which are consumed by the mass population in India. So on the statistical basis, if we say, then India has a very high burden of micronutrient deficiencies caused by vitamin A leading to night blindness, iodine to goiter, iron to anemia, folic acid to various birth defects. This is the survey according to National Family Health Survey. And we can see more about 59% of the children, they are anemic, and about 53% of the women in the reproductive stage are also anemic. So what are the benefits of fortification? We will see then fortification is being done on the staple food, and staple food are being consumed by the mass population. Second is, it's a safe method of improving the nutrition among the people because the quantity may be added is less, but it is well defined as per RDA, that is recommended daily allowance. Third one is its cost-effective intervention. Last but not the least, it doesn't alter the characteristics of food like taste, aroma, and the texture of food. So to come up with all these deficiencies and diseases are there, under Food Safety Standard of Authority of India, one center is there, Food Fortification Research Center, that is called FFRC. And its main purpose is to promote the large-scale fortification across India. And so whatever the information if we want to have regarding the standard food safety, technology processes, from where the premixes can be procured, from the equipment we can have. So all these are listed under the FRC. So what are the major vehicles which have been selected for the fortification, as we discussed earlier also? So main staple food like salt, milk, edible oil, rice and wheat. So salt is being fortified with iron iodine, that's why it's called double fortified salt, and milk and edible oil with vitamin A and D, and rice and wheat with vitamin B12, folic acid and iron. And how these fortified food is being distributed through the mass population, it is through various safety net schemes, that is ICDS, Integrated Child Development Scheme, MDM, that is Midday Meal Scheme, and third is Public Distribution System, that is PDS. So now what are the challenges of this fortification? So one is disadvantage, you can say, if it is overconsumed, then it is a risk. Again, quantity of fortification, excess dose, if we are taking for vitamin and mineral inadvertently, then it can have harmful effects. Then comes the selection of raw material and premixes should meet the recommended RDA. And last but not the least is premix. If whatever the premix is being used, if it is not uniformly distributed, it may result in high or low doses during the intake. And last is degradation of vitamins during the period of shelf life. This is again a challenge. Now I will discuss something about the general challenges I have discussed. Now I will discuss the analytical challenges while testing what we are facing. So one of the main challenges is that methods availability and their applicability matrix wise. Means number of matrices are there. Being a testing laboratory, when we analyze a sample, we perform the testing of these micronutrients. So method plays a very important role because matrix interference there. Matrix, to remove this matrix interference, specific method has to be verified and developed. So this is a challenging area. Then comes the over fortification is in low concentration and sample quantity for testing is very low, which is usually not a true representative sample of the overall product. Because whenever we are performing testing of this micronutrients, vitamin A, D, whatever the iron, so whatever the quantity as per method, general method we are taking hardly you can say 0.1 gram to 0.5 grams. So sample quantity or 1 gram maximum. So 1 gram sample what we are taking is a representative and very low. So sometimes this is a main challenge. Then the measurement uncertainty of the method, sometimes above the range of RDA at very low level of detections. So whenever the lab is performing the validations or verification, definitely it is as per for pesticides as per SANTI guidelines. But still, the guideline says that at the lower level, more than 50 to 60% recovery is okay. So when we are talking at the very low level, recovery may be less, but it may impact because the measurement uncertainty will be on the higher side. Now what? So now I have discussed the challenges what we are facing in the analysis. So we at FICCI Research and Analysis Center has been working in the R&D segment of nutrition and fortification for the last decade, and some of the activities which we have undertaken are like we have built the product that is RUTF, that is ready to use therapeutic food, and it is specifically designed to treat severely acute malnutrition SAM children. Second is we have done a project for Jharkhand government, that is acceptability on micronutrient fortified food, that is Panjiri and Nutri-Upma. Then fortification and shelf life enhancement studies for various Indian beverages, method development and verification studies for various fortified food matrices. So we have the specific designated R&D center in FRAC, and now I will just in brief I will discuss what is FRAC. So FRAC, FICCI Research and Analysis Center, it's established in year 1989. It is NGO, non-profit organization. It's a center of excellence for food analysis, food safety and quality control. It's supported by MOFPI, that is Ministry of Food Processing Industries. And our governing council consists of nominees of FICCI, SIFTI, eminent scientists, experts and nominees of state and central government. In FRAC, FRAC is NABL accredited, recognized by BIS. We have approvals from FSSAI, DSIR, CPCB. We are also registered with MSME. We are paneled with, empaneled with FOSTEC as a training partner. And we are also OSHA certified 9001, 14001, 22000 certified. In fact, we have the various setup of the laboratories for all type of food analysis. So in chemical lab, basically we are dealing with the macronutrients and adulterants testing. In instrumentation lab, we are involved in the testing of micronutrients, vitamins, minerals, then contaminants, that is antibiotics, pesticides and metals. In microbiology lab, we are dealing with the bacterial, virological testing, all type of pathogens and non-pathogens or hygiene monitoring. In environment lab, we are dealing with air, water, soil and noise monitoring. And specifically in our R&D setup, we are dealing with the product development, sensory evaluation, shelf life enhancement and photostability studies. And we have the dedicated shelf life study lab where we have multiple stability chambers where multiple shelf lives for the products food analysis is going on. And when I talk about the equipments, we are having all type of advanced equipment like LC-MS and HPLC. LC-MS dedicated for the pesticides and antibiotics, nutritional profiling. Then HPLC dedicated for some nutritional analysis. GC-MS for pesticides analysis. GC Headspace for residual solvents. Then ICP-OES dedicated for mineral analysis. ICP-MS for heavy metals and RT-PCR for pathogen testings and many more. This is just the latest equipments I have noted on. And last slide I have for our R&D facility. This is DSIR approved, that is Department of Science, Industrial and Research, and it's also ISO 22000 certified. Pilot scale plant is available for the studies. And facilities include, we have the stability chamber, planetary mixture, drying ironing, wet grinding, manual and automatic packaging and many more equipments. So that's all. So with this, I come to end of my presentation. Thank you very much for being a great audience. So any questions, I'm sure to answer.
Thank you so much, Doctor. So any questions? Yes, we have one question. Gentleman in front.
Yeah.
Ma'am, Janindo. Ma'am, in RT-PCR platform, which are the tests you are doing? Which are the antibiotic you are considering and which machine you are using?
Sir, RT-PCR we are using only for the pathogen testing. That is Salmonella and certain more pathogens.
Majorly it's a bacteriological test.
Yes, sir.
Okay. Yes. And which machine you are using?
It's Agilent, sir.
Thank you. Any further question for Madam? I think one question from
From LT Foods. So thank you, FRAC, for doing excellent job in fortification. We are also into the rice fortification, and we are facing lot of challenges when we are processing for the fortified rice kernels, and at the same time when it goes into the various ICDS and MDM and PDS schemes when they cook it, and at that time also, because, so I request you, is there any facility where we can analyze the fortified rice pre-cook and post-cook? And also like to know about the shelf life and stability studies if you are doing it, along with the packaging, as we are also involved with World Food Program for doing this shelf life and different packaging studies, so that we can come out with the solution which packaging is best suited with which type of shelf life we are giving. So I just want to know three things: the analysis part and the stability, shelf life, and the packaging studies. Thank you.
I think we are doing for this folic acid, vitamin B12 and iron, all the three fortificants. So in detail, if you want any information, we can share with you. So method is well established, verified for that, and results are coming good on that front. And for this shelf life studies, all chambers are available, ma'am, with us, and we are performing all the shelf life studies, whatever is the requirement at the real time as well as accelerated studies. So dedicated chambers are there with us. We have a complete means basement floor for this stability studies. So you can have and you can visit our facility also and we can discuss.
Thank you so much. Any question for Dr. Monika? So, I would like to thank, first of all, Dr. Monika for giving that wonderful presentation and very insightful as well. And she's available throughout the day, and our partner FICCI is already having a stall as well. So for any further queries, I would request all of you to kindly visit FICCI stall to get more insights about their offerings. And Dr. Monika herself is available, so she can be reached anytime offline as well. Can we have a big round of applause for Dr. Monika Gupta here? And now I would like to quickly call on stage Mr. Prashant Bhatt, Chief R&D Officer from Mother Dairy, to do the honors of felicitating Dr. Gupta here. Prashant ji, welcome back again.
Thank you very much, sir.
Thank you so much, Dr. Monika, and thank you so much, Prashant ji, for doing the honors.